This is for more focused role of midwives, promote for normal birthing, organize leadership and advocacy training program for latest updates related to midwifery, and membership drives should be continued. And because of this conference, we could raise a good number of membership in Assam. Thank you so much. This is from Assam sector.
I'd like to add, you expected from SOMI to do. You are also SOMI, so you all can initiate. We can support you all. Thank you so much. Next, Chhattisgarh.
कोई प्रेजेंट कर रहा है
मैम मैं इधर से ही प्रेजेंट हाँ देखना
नहीं somebody हाँ आ गया ना लाइट्स कम करवा दो लाइट्स
Good afternoon to all executives. Here from Chhattisgarh chapter, I am Mrs. Sapna Thakur going to present our action plans and regarding the reports. So, please next slide. Next difficult now. I am not going to read all this thing. Next कर दीजिए. Next आगे बढ़ा दीजिए. Next slide please. Next कर दीजिए. Please next. Okay. So in the background, I just want to say that we are having about 87 of general nursing midwife institute in our Chhattisgarh, and BSc nursing about 106, जिसमें government का 8 है and private institution 98 है. Post basic institute 18 है and MSc nursing institutes are about 23. And total registration, it is the data on 2020. मैंने recent data I have asked to registrar, but till date जब तक मैंने report बनाया मुझे नहीं मिला, तो मैंने ये 20 का data इसमें डाला हुआ है. In which ANMs are 18,508, GNMs are 13,548, BSc nursing are 17,006. If we will see the total registration in our state is about 52,748 nurses are registered. And with this, we found that there is not enough nurses or midwives as per population, but there are still enough to give mother and newborn care. In order to provide comprehensive care during pregnancy, labor and delivery, postpartum period, the midwives, yes, we know that it is essential. But our state midwives continue to lag behind in terms of their expertise and evidence-based method, and which we have found during our clinical posting in the wards. We have seen the labor rooms, so which we have found that they are really lag behind in the terms of expertise, and they are dependent on the doctors totally. And this could be one of the cause of high prevalence of 137 maternal and newborn death among 1 lakh live birth in Chhattisgarh. So, the Society of Midwives of India advocates the advancement of midwife as a profession and achievement of the motherhood. So, for that, in this year, Chhattisgarh midwives who are registered and inspired by SOMI Association mission work together to build a strong cadre of midwives via leadership and development training. So we have tried to influence the government nurses also, and in the private sector also we tried to influence them to be a SOMI member. So I think I don't have the data now because I have asked Sandhya madam to give, but till now I have not received how many are registered in SOMI. So I don't know how many members are there till date. So sorry for that. 511. This year, because of this conference, I think till 24 December, it is 511. Okay. Till soon, man. Yes. We are trying that one. Next. So now history. Little bit I will tell that it is started in SOMI has started in our state on 1998, between 1998 to 2000, under the leadership of Dr. Prakashama ma'am and the Dr. Mrs. Maya Patiya ma'am. And after that, SOMI full-fledged it is started from 2007, and from in 2010 Prakashama madam was there on, I think on 2012 madam was there in the state conference. Ukande madam is also there in that conference, in which both madam have selected the secretary, me as a Sapna Thakur as a secretary and Sushila Bais madam as the president. And under their directions, till date we are working there in Chhattisgarh. And objectives, according to the objectives, we have made our action plan. So our objectives are restrain the midwives and updates their knowledge and practice to boost their confidence. And second objective which we have made, restore the dignity of childbirth by transferring the idea of supine delivery system and upgrading the labor rooms facilities. Third, gain the knowledge and about the providing respectful maternity care consistently in maternity department. And fourth, fostering the midwife leadership abilities so that they may advocate the mother's right and their own rights before the policy makers. So for that, I should deal the action plan. What action plan according to action plan should I? Okay, ma'am. So our first objective was to restrain the midwives and update their knowledge and practice to boost their confidence. So we have planned to do the frequent workshop and skill-based training on SBA and NRP for midwives in various regions of Chhattisgarh state, and also train the and make a conversation to the remote Chhattisgarh location. Incorporated with the eco virtual training system. We have taken the eco virtual training from the eco group. Also for that we had one meeting with the president madam, and we have planned for that also how to use that eco to conduct the trainings for the nurses, those who are living in the remote areas, who are not able to come into Raipur or Bhilai, where we are conducting the direct workshops. So we are planning for that, and motivate the Nursing Institute to develop skill labs and simulation labs and give hands-on training to students to build their confidence. So for that also we are working, in which we are motivating the nursing student to develop these skill labs. Somewhat it is means ये थोड़ा सा other वो हो जा रहा है. We are going for some exams and for some inspections. तो वहाँ हम ये काम करते हैं कि स्किल लैब्स जहाँ पर नहीं डेवलप हुआ है वहाँ मोटिवेट करने का काम और उनको डेवलप करने का काम. फॉर दैट अभी बहुत सारे जो हमारे बैकवर्ड थे, मतलब ऐसे प्राइवेट नर्सिंग कॉलेजेस जो मतलब उनके पास जमीन भी नहीं थी, तो अभी के सेकेंड इंस्पेक्शन में आई फाउंड दैट दे हैव द एडवांस लेबर डमीज, क्योंकि उनको बार बार वो मैडम है मेक वन ग्रुप, ओबीजी ग्रुप और सोमी ग्रुप बना के रखा है सुशीला मैडम ने, तो जिसमें वो बार बार चीज़ों को डालती रहती हैं. तो उसके थ्रू एंड आई हैव देयर टू मॉनिटर दैट थिंग. तो वो चीज़ थोड़ी सी डेवलप हुई है कि नाउ दे आर हैविंग द एडवांस डमीज in the private sectors where they are very reluctant to buy this advanced dummies, क्योंकि वो बहुत महंगी होती हैं. तो ये थोड़ा सा हमने किया है. And to restore the dignity of childbirth by transforming the ideas of supine labor delivery. तो ये थोड़ा सा हार्ड वर्क, मतलब ये थोड़ा डिफिकल्ट टास्क है. establishing an IPR to modify the labor room environment, collaborating with district maternity department, the government and the private hospitals. तो जैसे last time also in the conference, Madam has motivated us to give the different birthing positions. Yes, so yes, it is very difficult for us because now, but we are trying. As I am also posted in Durg, तो दुर्ग में भी वी आर मोटिवेटिंग दी नर्सेज, वहाँ नर्सेज डिलीवरी कर रही हैं. तो अभी फिलहाल वी आर ट्राइंग, लेकिन अभी तक हो नहीं पाया है कि हम सुपाइन से उनको दूसरे उसमें लेके आए, बट वी आर ट्राइंग टू एजुकेट देम. तो वो भी एक चल रहा है, बट इट इज़ नॉट येट सक्सेसफुल. एंड अबाउट गेन नॉलेज अबाउट प्रोवाइडिंग रेस्पेक्टफुल मैटरनिटी केयर. तो इसमें हमने वी हैव द पिक्चर्स ऑल्सो दैट वी हैव कंडक्टेड रेस्पेक्टफुल मैटरनिटी केयर का हमने DOT लिया था from Indore, and after that going to back PG College of Nursing में हमने plan किया. तो we have trained the teachers there for respectful maternity care. Now we are getting so many means feedback from the different colleges, जो private colleges हैं, they want to conduct the respectful maternity care trainings for their hospital. जैसे कि रावतपुरा हॉस्पिटल अभी नया खुला है रायपुर में, तो रावतपुरा की जो प्रिंसिपल है दे हैव अप्रोच्ड और वो ट्राई कर रही हैं कि हम वहाँ भी रेस्पेक्टफुल मैटरनिटी केयर का ट्रेनिंग करें. और इसके साथ ही साथ शंकरा बहुत बड़ा एक सेटअप है, तो शंकरा के भी जो प्रिंसिपल हैं दे आर कॉलिंग सुशीला मैडम अगेन एंड अगेन टू डू दी TOTs फॉर दी नर्सेज ओवर देयर. तो ये TOT का हमारा थोड़ा सा काम वहाँ पर तेज है रेस्पेक्टफुल मैटरनिटी केयर के लिए. और हाँ मैम थोड़ा सा पिक्चर्स दिखा दी. व्हाट वी हैव द एक्टिविटीज प्रीवियस स्लाइड्स में. यस, फॉर एक्टिविटीज फ्रॉम 2023 to 25. तो जो मेजर बाकी तो these all activities we are doing in the ward, which I am not going to deal the awareness programs and all. लेकिन जो इसमें मेन हम लोगों का रहा है वो रहा है जो रिस्पेक्टफुल मैटरनिटी केयर के ऊपर सुशीला बायस मैडम एंड यस 14 नेशनल कॉन्फ्रेंस में CG चैप्टर ये हमारे द्वारा ऑर्गेनाइज किया गया था. ये तो खैर पुराना है. इसके हाँ ये TOT का है जिसमें हम लोगों ने अटेंड किया था इंदौर में एज अ TOT ट्रेनर. हम लोगों ने अटेंड किया था, उषा गांधी मैम ने करवाया था ये ट्रेनिंग. ये ट्रेनिंग हम लोगों ने PG कॉलेज में करवाया, जहाँ अराउंड 36 ट्रेनर्स हमने ट्रेन किए जिसमें. और यस, सो दीज आर सम पिक्चर्स ऑफ आवर एक्शन जो मेजर. Thank you.
Thank you so much, ma'am, for your elaborate explanation. If you have not shared the hard copy, word draft of this, please share with us. Yeah, share please. If it is not, then next I would like to request Delhi chapter 2.
Good afternoon, Madam Prikashama Madam, Harsha Madam, and all the executives. Our chapter also has started from 2000 onwards, and I have taken the charge from 2022 after coming back from ministry. Just next. Next slide, please. Okay. So here my president in our chapter is Mrs. Tracia Haldane, and the vice president is Ms. Savita Yadav, and we have assistant secretaries Preeti Dination and Nikita. Treasurer also has taken charge, and we have 418 members now, and from 2023 to 2025 104 new members have been started. The International Midwives Day has been celebrated by participating in the various organizations like Catalyze 3 and WRA and we participate in all these discussions, and also we are taking the message to the patients and in the community as well as in the hospitals. We empower midwives and the practicing people in the labor room and other maternity wards by organizing weekly sessions in their departments. And we also have made little changes in the organization in the central government institution. Lucknow, we could take more than 15 persons by the support of the government. They have that was the first time government has given registration fees for nurses to participate. With the advocacy, we could bring 15 persons in the Lucknow, and this time we have we got only two, but they have been given flight charges also. So that is one system change what we could do in the central government. So that gives them empowering midwives by getting that opportunity, tapping that resources what is already available there for doctors, that has also been extended to nurses. That's it. We also have collaborated with the NQC, National Quality of Care Network, and had done 2 days workshop of point of care quality improvement with in collaboration with the All India Institute of Ayurveda as well as NQCN. And our advisor Bandana madam could spare time and be with us. And there are more than 80 persons have been trained for 2 days quality of point of care quality improvement training. And all the resource persons were SOMI members. SOMI members acted as a resource persons here. Safe Motherhood program, again we have very good active members of auxiliary nurse midwives as the SOMI members, and the drive is continuously going on. We have ANM Geeta, very active member, but recently she has stepped down from her position and brought new persons into that position, and she took the charge in the TNAI, which doesn't allow them to work in other organization. So even though she stepped down from that position, she still continue, and she spread this informations and all these activities to other ANMs and other nurses also. So it is actively participating. Even being in the Delhi, we participate in other organizations and associations, work for National Safe Motherhood. And then the breastfeed. Yes. Next slide, please. This is a program where we had brought the experts from All India Institute of Medical Sciences on preventive oncology, especially on breast care, and the residents, women are empowered by having this training as well as awareness programs, as well as followed by screening of all of them. More than 15 persons from the Residents Welfare Associations have participated in this. Next please. We had also got opportunity to organize a Northern Regional Conference in 2024, which we planned, and we were expected to do it in the month of July, but because of RG issues, it had to postpone to October. And then in that we had more than 269 persons have participated in that, of which 219 persons registered, and it included students, ANMs, and more than 20 states have participated in that, even though it was regional. And I got all the cooperation and support from northern chapters, and it was 2 days program again, where there was skill trainings as well as sessions and poster and research presentations were there. Next please. Recently we had the visit from the headquarters by the Prakasha Ma'am, and whenever both the years we had, and we had visited our first ever president, and we had collaboration with other associations like ECO, AIMS, etc. Focus group discussions have been taken place there. This is the International Women's Day celebration, which has again taken care of women as well as midwives separately at various units of Delhi. The things were celebrated for celebrating womanhood. For both the midwives, then health workers as well as general public. So we discussed all these things. Other than this, 4 more collaborations I had with the support of SOMI headquarters. One I had with the Sultan Qaboos University. For that, we had organized program of active learning, which was virtual. Another collaboration with Health Action Training, which is again an international organization. During the National Safe Motherhood Day, they have many of the international midwives have connected virtually through ECHO, and the awareness and the midwifery practices in those states have been shared with the other SOMI members and other people whoever have registered. We also had collaborated with Astika and they celebrated breastfeeding week, where they are the practicing midwives, NPMs, have taught the public and given an awareness about the birthing positions and the new changes. Just the last slide, please. We have been participating in the activities. We have also attended the Himachal Pradesh chapter's leadership training program as resource persons last year. And we also have visited Jammu and Kashmir and their chapter also as a representative of SOMI. So every month we had one or other program. We had made annual calendar. So this is the way forward. National Safe Motherhood Day 2025 we are planning to have it in collaboration with the Athlete for Change, where the nurse midwives, because the midwives, what are the challenges they are facing and how they are handling that changes. We are preparing the midwives to present in that. Then we are also planning for having International Midwives Day 2025 on 5th of May at RIT College of Nursing, where we are expecting international team also coming. So which we are planning to have 1-day program with any government senior officials to be there, to have the commitment from the officials on the Midwives Day. We are expecting around 100 to 150 participants and experts. We are also working towards preparation of midwifery protocols in the government hospitals and the private hospitals with the support of SOMI and with the experts' inputs that can be made possible. Initiation of NPME and NPM is another one which is under pipeline. Delhi has also already identified the centers, but in May 5th we are expecting some new things. Yes, as a SOMI we were not being identified or recognized or invited, but we are continuously trying to pitch in as and when we are aware about the movements. So we are trying, yeah. Also Lakshya certification and the NPME trainings to start in the central government hospitals as well as AIMS. So we are working for that. Virtual training of evidence-based midwifery practices through ECHO. Orientation of the nursing personnel regarding the guidelines. And also we are thinking of having the quality midwifery education and evaluation through in the universities through the board of studies. We are also wanted to make some guidelines or the format under which the students should be evaluated and prepared enough to work as a midwife. These are the things. Thank you.
Thank you, ma'am. Next, I would like to request Gujarat. Please adhere to the time, 5 to 7 minutes.
Hello, good afternoon, respected SOMI executive members, India level, all respected chapter secretaries and all other respected delegates. I am Hetal Bhatia, lecturer senior skill class 1 at Government Nursing College, Ahmedabad, Gujarat, as well as SOMI Gujarat chapter secretary and NPM coordinator at our SMTI and NPM faculty also. So if we see about the history of Gujarat and Gujarat chapter, then I can't operate from here, sorry. Okay. Now it's working. Now it's working. So this is just regarding the Gujarat. It's a big state with the land of region, deserts and forest. So Gujarat has also fastest growing economies in India with the contribution from industries, agriculture as well as trading. Next ma'am. Introduction of SOMI Gujarat chapter was established in August 2005 in the state of Gujarat under the guidance and support with Dr. Prakasama madam, and ma'am was founder of Gujarat chapter. Since 2005 we are having Gujarat chapter. The establishment of SOMI Gujarat chapter was a result of midwifery development in Gujarat. Subsequently, the SOMI Gujarat chapter has increased their members day by day, and I pleased to announce that currently we are having total number of SOMI members from Gujarat chapter is 1,607. Thank you. Next one. During the establishment of SOMI Gujarat chapter, the members consisted late Mrs. Anandibem Chauhan, Miss Jasu Madam Patida, ma'am is here, Mrs. Jyosna Madam Pandya, Miss Kanak Madam Solanki, Mrs. Pragna Madam Sa, and Mrs. Saroj Madam Christian. These are the current executive body of Gujarat chapter. President is Dr. Bharti Madam and Sanadia. Principal Government Nursing College Vadodara, Gujarat. Vice President is Dr. Hiral S. Shah, in charge Principal Government Nursing College Jinera, Ahmedabad. And Chapter Secretary. Treasurer is Mrs. Falguni Modi. Principal AMC Med, Ahmedabad, Gujarat. Next one. So midwifery initiation in our Gujarat. On our Gujarat NPM initiation started in since 2009. This first batch of NPM we started in 2009, and since 2021, around 461 NPM passed and get placement NHM under contractual basis. But we started very long years ago with annual intake of 20 seats at each SMTI. We are having at present 6 SMTI in Gujarat and 1 NMTI. For previous one. Further, Gujarat Nursing Institute of Nursing Education and Research, my college, Government Nursing College, is designated as National Midwifery Training Institute, identified by Maternal Health, Ministry of Health and Family Welfare Department, Government of India, New Delhi, in September 2021. Next one. So, we started first batch of NPM in October 2023 because between 2021 to 2023 there was COVID. So we started in 2023 with intake of 30 seats in Gujarat. At present, 24 NPM trainee completed their 6 months training at our NMTI, Jinera, and currently they are doing their mentorship. Next. Okay, these are the certain activities of our Gujarat chapter under SOMI. We celebrated, I took charge as a chapter secretary of Gujarat in 2023. So I have data since 2023 to till now. So we celebrated National Safe Motherhood Day at our Government Nursing College with the efforts of the all college faculties, international midwifery educator. We were also 2 international midwifery educated at that time. HOD of OBG department and NPM who are working in MLCU. It includes the certain knowledge activities like poster competition, quiz competition, theme speech, research presentations, case presentation by NPM, and felicitation of NPM who are working in MLCU. These are the peaks of Safe Motherhood Day celebration in 2023. These are also Safe Motherhood Day celebration at SSG Hospital, Vadodara in 2023. They are also conducted this kind of the activities. Next one. These are the peaks of Vadodara Government Nursing College. Next in Safe Motherhood Day celebrations, we celebrated in 16th April 2024 in Genera, and the students are perform different activities. They perform the different quiz competition, next poster presentation. These are the peak of their peak. Next, they conducted our NPME training. They conducted role play regarding the alternative birthing positions and respectful maternity care. And also, next slide. This is the International Midwifery Day celebration at Genera 2024. And in this, the students and NPME trainee as well as faculty members as well as the students of the 4th year BSc nursing students, they perform different activities in the Department of MSU as well as college. Next. The NPME training, here in peak you can see the NPME training. They are conducted one panel discussions on theme of midwives and alternative birthing positions. They discussed regarding the respectful maternity care, and those are the some topics they were discussed. Also, they arranged one quiz for the among 4th year BSc nursing students, and the quiz competitions they were enjoying at that time, and we also felicitated them with the prize also. Quiz competitions. Then breastfeeding week celebrations we celebrated in August 2024 among 3rd year BSc nursing students with the role play about the importance of breastfeeding at Civil Hospital Ahmedabad with the help of hospital staff, NPM staff, faculties and students of Genera Ahmedabad. Next. These are the pics of breastfeeding week celebrations we conducted role play. Okay, in our special activities, we conducted 2 symposium at our Gujarat with this on the essential newborn care with the support of Himalaya and SOMI, SOMI India. Symposium 1 was conducted at Changa, Charosat, Manikaka Topawala Institute of Nursing, and there were 66 participants attended this symposium. These are the pics of Changa symposium. One other symposium we conducted at Dahod, SD Darawala College of Nursing, Dadrawala College of Nursing, Dahod, Gujarat chapter, on this September, 20 September 2024, and 130 members attended this symposium, and these are the pics of that symposium. Jasu Madam is available, Jasu Madam was available in both symposium at that time. Unfortunately, due to certain circumstances, I couldn't attend this. Okay. Coming to my action plan. Okay. We are having the English SOMI members. But we still try to increase our SOMI members. I motivate my all NPME students to get registration of SOMI, lifetime registration of SOMI, and we also be a part of a certain state and national level SOMI conference. We try to strengthening our midwifery education as well as practice of midwifery with enhancing clinical skills and ensuring quality maternal and newborn care. We also celebrate, we will be celebrating the all various days like Safe Motherhood Day, International Midwife Day, Breastfeeding Week, Women's Day, International Women's Day, etc. We will try to organize some workshop, seminar and midwifery training programs for the maternal and newborn care. And we strive to strengthen midwifery education practice and certain education and research activities, especially in the for the maternal and child health care. Thank you so much for giving me chance to speak regarding my chapter. Thank you so much.
Thank you, ma'am. Next, I would like to request Kerala chapter 2. Please adhere to the timings.
Good afternoon, everybody, respected executive members and all the chapter secretaries. So I would like to introduce myself Mia. Chapter Secretary of Kerala from 2022 onwards. So as an introductory, so key people of SOMI, President Dr. Lata R. Former JDME Kerala, myself Chapter Secretary. Next time. So regarding the history of SOMI in Kerala, established in the year 2000, is a 25-year-old registered organization established with a mission to improve the maternal and newborn health. SOMI serves as a platform for midwives to enhance their professional skills, advocate their rights, and contribute to the healthcare system of the country. Next slide. So this organization was formed with the collective efforts of healthcare professionals, educators, and policy makers committed to the growth and recognition of midwifery as a vital profession in Indian healthcare system. So first, the SOMI was organized by MONC College of Nursing Kollancherry on 2008. A tentative plan was scheduled. Next slide. The then Chapter Secretary, Sindhu Madam nominated myself as a new Chapter Secretary of SOMI after the 14th National Conference of Raipur, from Raipur. The action plans from 2023 onwards is that along with Himalayan Group, we conducted one-day symposium on essential newborn care for the JPHNs. Next slide. Next slide, please. And Safe Motherhood Day and International Day of the Midwife was also observed. In 2024, SOMI in collaboration with Birth Village Kochi last year organized one-day conclave on May 4th based on the International Midwives Day, based on the theme. Dr. Usha Madam, previous slide, President of SOMI, as well as myself and Dr. Riddhi Balachandran, Madam participated in the panel discussion and the midwives conclave, followed by International Nurses Day programs at Kannur district, and it was also inaugurated by our Usha Madam. And SOMI also encourages each and every institution in Kerala for celebrating International Midwives Day, Nurses Day, and Breastfeeding Week in timely manner. Next slide. Next slide. Next. In last 2024 December 30th, SOMI along with Himalaya Wellness Group conducted the Essential Newborn Care Symposium at Astor Mims, Kannur. More than 200 members participated, staff nurses participated, and also about 17 new SOMI membership was also registered in the last year. Total we are having 266 members in the SOMI right now. And regarding the action plans, this year also, in the coming next month, we are planning to conduct a symposium on regarding the respectful maternity care, and also the hoisting the celebrating the International Midwives Day in Trivandrum, and we already discussed those things with Dr. Prakashima Madam 2 hours before, and also the coming all the days will be celebrated accordingly. These are the action plans from the Kerala.
Thank you, ma'am. Next, I would like to request Martin Pradesh to present.
Thank you. Good afternoon, respected Madam Prakasham, Madam Usha Pandey, Executive Member, and respected all the Chapter Secretary. Myself, Dr. Sarita Thakur, I am former registrar, and currently I am working as a professor cum principal in Abhilashi Nursing University. My chapter is newly born. It is very little. It is 2 years old. So, less than 100 members I have connected, and presently I have organized a symposium with the help of Bank on the newborn care. First aid symposium I have organized in 2024 on essential newborn care. I have involved our Director of Medical Education in this program, because when our head is representing to something, that program is very effective, and most of the people that time I have registered as a member. And after that, that symposium we have conducted in Kamala Nehru Hospital, that is especially for mother and child. And the staff nurses who is working there, they registered that time near about 20. After that, next. In this symposium, Madam Shanta, she was matron that time, was chairperson, and following members were included. These are my members, and we have no executive official state. I want to announce very soon. Next. Then next, these are the pictures. These are, he is our Director Medical Education. These are the gathering. 100 participants is there. And Ma'am Rati Balchandran was the chief guest. And next. We have planned for panel discussion, and in my tenure, when I was a registrar, I have organized workshops on respectful maternity care and aware the peoples. Actually, in my state, there is a government job. There is no private hospital and no nurses working in private. So it is little bit difficult to motivate me in government employees. So I request ma'am with all the pledges. जैसे मैम अगर हम इनको जैसे मैंने मेंबर बना दिया, they ask to me कि what is the benefit? They ask to me again and again, what is the benefit to us? तो मेरी एक रिक्वेस्ट है कि जैसे हम ऑर्गेनाइज करते हैं, कोई जैसे कॉन्फ्रेंस कर रहे हैं, कोई कर रहे हैं, तो थोड़ा सा इनके लिए कुछ छोटी सी कोई ऐसी चीज़ रखें कि हम इनको कुछ रिलैक्सेशन दें. Otherwise it is difficult to convey them and difficult to इनको motivate करना is a little bit difficult now. And after that we have planned for breastfeeding day. It's circular. Next, yes. Breastfeeding week celebration in 2024. Next. Next. And we have demonstrated feeding positioning, burping with dummy and all, जो भी था. And postnatal antenatal mothers के लिए जो थोड़ा सा हमने एक नुक्कड़ नाटिका किया था, in the ward किया था हॉस्पिटल में. Next. This is about my chapter because अभी थोड़ा टाइम हुआ है तो newborn है. Thank you. Thank you.
Thank you, ma'am. Newborn also will grow as toddler, as a child, and as an adult. Thank you so much, ma'am. Next, I would like to request Madhya Pradesh.
Good afternoon to all respected teachers. Myself, Dr. Mansi Chaudhary, Secretary, Madhya Pradesh Chapter. There are 55 districts in Madhya Pradesh and categorized in 10 divisions. There are 5 major cities in Madhya Pradesh like Bhopal, Jabalpur, Gwalior, Ujjain and Indore. MP is the second largest Indian state by the area and 5th largest state by population with over 72 million residents in Madhya Pradesh. There are varied areas in midwifery practice including maternal, child, adolescent, sexual and reproductive health and family planning. Therefore, continuity of care is required. There are key challenges in state of MP in midwifery professional growth, evidence-based practices in midwifery and reduce MMR rate. Need to prepare midwifery leaders with the help of Usha Kandemam support and all leaders and independent decision makers and practitioners also. And our goal to strengthen midwifery-led care services to reduce the maternal morbidity rate of MP and objectives to ensure 100% institutional deliveries to promote natural childbirth process and reduce interventions during labor with the help of natural childbirth, to organize meeting regarding midwifery-led care approaches and history of our MP chapter. SOMI MP chapter was established in the year 2005
and this chapter established by Dr. Usha Kande ma'am, President, and Mrs. Soni Topo ma'am, Secretary in the year 2005. Current Executive Committee members, Dr. Usha Kande ma'am is a State Advisor, and Mrs. Soni Topo ma'am is a President. Mrs. Sudha Rani madam is Vice President from Gwalior, and myself Secretary, and Mrs. Sunita Dangi Joint Secretary in MP chapter, and Lily Poddar madam Treasurer. Our chapter activities in last year 2024 to till date. First activity organized TOT for SOMI leadership on respectful maternity care, organized by Usha Kande ma'am, and certain organizers in this TOT, Center for Catalyzing Change, White Ribbon Alliance, and Society of Midwife India in collaboration with Christian Hospital and Serum EDU. In this training, 2 days training, 1st and 2nd August 2024, and we are learned lot of things. Total 32 participants in this training, and hands-on training with skill stations, and many things are learned. New techniques. Some pictures are there, please see. Next. Okay. And second activity, 2 days hands-on training on breastfeeding support. Our college was organized 7th and 8th August 2024. In first day hands-on training sessions, anatomy and physiology of lactation, common breastfeeding challenges and solutions, managing special situation in breastfeeding, prenatal education, initiation of breastfeeding. And second day, skill stations for antenatal mothers, internatal mothers, and postnatal mothers with the help of students and my faculty members. Next. And third, report on Safe Motherhood Day under SOMI chapter. LNCT Vidyapith University was organized 11th April 2024. Some activities like health educations are given to patients. Next, World Breastfeeding Week, LNCT Vidyapith was organized, total 6 days. First day, video competition, Rangoli competition, role play, mimes, health education and diet distribution in antenatal and internatal mothers, and quiz competitions. And Career College of Nursing Bhopal, during the breastfeeding week, Nukkad Natak is presented for mothers. Particular raise awareness about the importance of breastfeeding, address common misconception, casteism, discrimination of religions related queries, emphasize the need for support system for new mothers, and play aim to educate the audience on the benefits of breastfeeding and essential role of community support and promoting maternal and infant health. And Women's Day also organized, total 38 participants in Women's Day. And on 28th Feb 2025, Usha Kande ma'am, me and one other faculty member, Marlene Raj, visited the Government College of Nursing Ujjain to meet the student at SMTI undergoing nurse practitioner in midwifery NPM training of 18 months initiated by the Government of India. A session was conducted by Usha Kande ma'am. Many new techniques were discussed, like wait for 2-minute cord cutting and immediate breastfeeding, which help in reduction of PPH and easy separation of placenta separation, imparted her experience to knowledge and skills. Some pictures are there. And our action plan under Society of Midwife to organize visuals meeting with all the stakeholders to roll out midwifery and NPM services in state Madhya Pradesh. Making a new SOMI members, currently 636 SOMI members. Setting up midwifery-led care unit, research activities, and TOT on natural childbirth. And in next, maybe May or June, organize one symposium or workshop in Bhopal. Now this time, one conference, SOMI national conference. That's why I extend the dates for our conference. Thank you so much, ma'am.
Very seriously, I want to know. ये चुन्नी है या ड्रेस है?
मैम ये चुन्नी है, उसको मैंने स्टीच
क्या
पार्ट में किया।
ऐसा किया she has done it. I'm thinking, what is this? I question in my mind, ये चुन्नी है या ड्रेस है? ऐसा होता है. Okay. हाँ? Al-Kalla. Beautiful, beautiful. See how creative the midwives are.
Thank you.
Break the ice. I thought we are feeling sleepy.
श्राद्ध कर ऐसे ही आ रहे हैं.
Thank you, ma'am. Next, I request Maharashtra chapter, please adhere to the time.
पानी मंगवा दो.
Good afternoon, respected Madam Prasamma, President Madam Nisha, Secretary Madam Asha, all respected executives, delegates and senior members. I am here standing before you to present report on Maharashtra chapter. Myself, Dr. Sangeeta Bhujbal. I am taking charge as a secretary since October 23. Executive members, chapter president is Madam Mrs. Mangala Joshi, chapter secretary myself, chapter assistant secretary Ms. Jasmine Jassi, chapter treasurer Mrs. Rudula Fule, and our central advisor Madam Lieutenant Colonel Anomani Venkat. Background and context of Maharashtra state. If you see, Maharashtra is a state located in the western region of India, and it is the third largest state by area and the second most populous state in the country. Estimated population in the year 24 is 125 millions, marking the second most populous state in India after UP, wherein if you see there is 28.9 million females aged 15 to 44 years age group, a very large population of this age. You can see Maharashtra is divided into 36 districts grouped into 6 administrative divisions. Maharashtra has made significant strides in improving maternal health through various initiatives and programs. The key indicators are the maternal mortality rate. Maharashtra stands approximately 46 per 100,000 live births. As per the latest records, better than the national average, but still a concern in the rural area. We need to focus on rural area where we are lacking. Then second is the infant mortality rate, 18% per 1,000 live births, with disparities observed between urban and rural area. Again, here we have to look into the subject. Nutritional status, if you see, nearly 25% of the women in Maharashtra are underweight, while anemia affects over 50% of the women aged 15 to 49. Reproductive health, assessed contraceptives and family planning services is improving, yet the rural region continues to face challenges in this regard. Maharashtra government initiates Mahatma Jyotiba Phule Jan Arogya Yojana, which provides cashless insurance for the families in Maharashtra. Then Pradhan Mantri Matru Vandan Yojana is there, where financial assistance is given to pregnant women to improve the maternal and child health. And we have Jeevan Jyoti Yojana, which focuses on subsidizing healthcare services to the women. Current status of midwifery services in Maharashtra. Nurses required in Maharashtra to ensure comprehensive health care. Maharashtra requires adequate number of nurses specialized in maternal and child health, community health nursing, geriatric and palliative care. So these are the areas where nurses are required on a larger scale. The goal is to strengthen midwifery-led services, to reduce maternal mortality and morbidity rate, to ensure 100% institutional deliveries, promote normal physiological birth process and reduce the interventions over medicalization during labor, and to organize meetings regarding midwifery-led care approach with the stakeholders. Maharashtra Nursing Council and its role in midwifery.
Maharashtra Nursing Council is a statutory body which is established under the Nursing Council Act in 1966, and it holds the responsible for regulating the nursing profession within Maharashtra. The council ensures the education, registration, practice standards for nurses, midwives and auxiliary nurse midwives. It also plays a vital role in ensuring quality care delivery through professional nursing. Role of midwifery advancement. Midwifery plays a crucial role in maternal and newborn care, and MNC actively promotes safe and effective midwifery practices through the following initiatives. They take initiatives in training programs, certification, promotion of normal work practices and community outreach programs. Total number of registered nurses, if we see, the ANMs are 10 lakhs 4,053, GNMs are 14 lakhs 1,133, BSCs are 4 lakhs 6,167, that is 29 lakhs 1,353 total nurses. 29. 2 lakhs 91,300. GNM is 1 lakh 4,053. 2 lakhs 29 lakhs 1,300. 2 lakhs 91,353.
These numbers have since their inception. Continuing is accumulated number exactly.
This is till the year 2024, end of 2024. It has increased. Okay.
This is not real. In any state it is not real. Not only in Maharashtra.
Okay. Then report of the Maharashtra chapter of the year 23-24. Society, actually there's a printing mistake here. We have started our SOMI in the year 206. It's 19 years old. Registered organization. We have 11 units there. Senior faculties who have initiated were late Dr. Tapti Bhattacharya ji madam and our Lieutenant Colonel Madam Manolmani. They took the initiative, followed by the nursing leaders from districts of Pune, and the Maharashtra chapter was opened under the guidance of the founder president Madam Prakasamma. The initiative aimed to address the challenges faced by the midwives and improve maternal and newborn healthcare services. The collaborative efforts were also taken by the other members followed. Then the activities that what we conducted in the year we had conducted a symposium on essential newborn care on 20th October 23. Here what we had done is we had approached the district health officer and we had requested them to depute ANMs especially for this essential newborn care and organized skill stations on normal birthing process. So in this we had nearly 130 and more ANMs were there for this particular symposium, and skill stations were organized and it was beneficial for these nurses. Then Women's Day celebration was done on the 8th March 24, Safe Motherhood Day celebration on 11th April, and International Day of Midwives on 7th May. Breastfeeding Week celebration week was from 1st to 7th. And now in first symposium, it was organized at BD Medical College of Nursing. It was supported by the Himalayas and nearly 1,000 ANMs had participated in this, and various nursing colleges, they took part in organizing the skill stations. From Pune we had arranged for this, and all nursing colleges have actively participated in skill stations. Then Women's Day celebration, actually it was done in all different areas of Pune. I have just projected one, but then each one they had gone to the rural health PSCs, some arranged in the urban health, where they collected the women in that particular area and discussed on the theme. Here I have just shown one which was organized by Sadhu Vaswani College of Nursing. Then Safe Motherhood Day celebrated on 11th Previous slide. Safe Motherhood Day celebrated on 11th April. Here what we had done is, in the antenatal OPD, we had arranged we had called as mothers there who were there, and a role play was conducted by the students on this Safe Motherhood Day, and distribution of high protein diet was given to all these antenatal mothers, and even we explained them how it has to be prepared. Then International Midwives Day we had arranged for a workshop, and in this Madam Prakasamma Madam was also there at this particular program, and here there were more than 500 participants were there for this International Day of Midwife celebration. Here also different skill stations, exercises, antenatal exercises, massage therapy, acupuncture, hydrotherapy, all these skill stations we had arranged for the ANMs and GNMs. These are some of the pics which I have shown. Breastfeeding week was also celebrated in different colleges in the urban and rural areas of Pune city. Thank you. So these were our events we had planned. Our total membership till today is 1,526, but we need to increase because it stands the second largest population state. So it has to be increased, and we are going to definitely have a drive for membership. And then even we have planned to conduct CNEs, actually CNE, Continuous Nursing Education Program for, okay, and we can say medical midwifery education program. So in this, what we are going to plan is, it is going to be in the community, in PSCs. The ANMs there, we are going to have specially for them. And actually in Maharashtra, what is there is, credit points are required for renewal of the license. And nurses have that incentive that yes, if I will attend that, I am going to get credit points. So based on this, we have planned to have midwifery education program for the nurses at the rural level. Then all the days like Safe Motherhood Day, Institutional Day of Midwives, International Day of Midwives, Rural Breastfeeding Week, and apart from this, planning for a state conference in this 2025. Nagpur, Chandrapur. No, they won't do anything for nurses. Yeah, that's there. Yeah, we are midwives, so they won't harm us. So this was our report. Thank you very much.
Thank you, ma'am. I kindly request everyone to adhere to the timings as we are running short of time. Next, we have AGBM also. Please, Kaksha. Ma'am. Okay, next, I would like to request Nagaland representative to present.
Good evening, ma'am. I'm so privileged to stand among all of you this evening. Nagaland, it's a first time for us representing such a SOMI conference, and as compared to Himachal, I think ours will be the newest one. Ours is just 9 months old SOMI Nagaland chapter. So we're just started to crawl. So I'm crawling here. We just started to crawl. I would like to start with my presentation. Actually, I am not the chapter secretary. Our chapter secretary was supposed to come, but at the last moment, due to some unavoidable circumstances, she could not be here, so I'm representing her today. And the slides were prepared by her, so I'm speaking on behalf of her. History is like SOMI Netherlands chapter was inducted in July 2024 with a total of 65 midwives registered so far. But because of this conference with additional 5 registered, so total we have 67 SOMI members. Ma'am, we had the honor that Ma'am Prakash Sharma, the founder, and Ma'am Bandana could come and inducted the SOMI Netherlands chapter last year. Because of which, as the chapter, we are here today attending the conference. Even though we are the newest one, we have 10 executive members, and we are so thrilled and excited to take forward our SOMI chapter. Even though some of us are here now, back home, there are executive members who are preparing for the upcoming National Safe Motherhood Day. So in order to save time, I'll just say the point. Activities conducted so far was Dutch skill lab training for the government staff nurses, Safe Motherhood Day, half-day workshop on obstetrical emergencies, International Midwives Days, one-day state level symposium, and breastfeeding week. Previous slide, yeah. I belong to a public-private partnership hospital. This is the only hospital in Nagaland with PPP, that is Christian Institute of Health Sciences and Research. And we are so fortunate that the institute where I am currently working is a nodal center for conducting Dutch skill lab trainings for the government nurses. I will not go in detail in order to save time. So, Safe Motherhood Day, all those activities, half-day workshop, International Midwives Day, one-day state level symposium, breastfeeding week. All these activities, the facilitators, the trainers are also SOMI members, and all our ma'ams. We are so fortunate that they are as a SOMI members since 2006, 2015. So we have very senior SOMI members, and because of whom all these activities we have conducted under their care. At the same time, since we have a college of nursing institute, the BSc nursing students, the GNN nursing students, in collaboration with them and SOMI, we have conducted these activities in our chapter so far. I'd just like to quickly skip the slides. Next, please, next. These are some of the pictures of the programs that was listed in the slide. Next, just skip the slides in order to save time. Next. As for the fund, since I have said we are just 9 months old, we have 0 fund. Yeah, but no funds. Yeah. So, but we are so fortunate that the Himalaya Wellness Company have sponsored one of our symposium. Yeah. Next, please. Next. These are just the pictures of the activities that I've listed. Right. Next. Yeah, here. Even though ours is just a new one, we may not have ideas like the other chapters have. I was so amazed. I'm taking so much of information, so much of insights from all the presentation. I'm so happy that I'll be carrying this information back to my Nagaland chapter and be sharing this during our meetings. So these are a few action plan forward that we have listed down. Half-day sensitization cum enrollment workshop. As I've mentioned, we have 65 SOMI members so far. Our aim this year is to at least cross 100. So that's our target. Yeah. We'll crawl and jump and run to 100. That's our target for now. And observing significant health days across the states. One day state level workshop. Team, I know we have not decided so far, but we'll be sitting for a meeting, and the midwifery related team will be focusing for the one-day workshop. Then we'll do fundraising activities for our chapter, and then we will try to recognize and award the best performing midwives. That's the plan, and we'll have executive committee meetings at least once in 6 months. That's the little plan that our chapter, Nagaland chapter, is planning, and I hope with your support we will be able to do it. Thank you so much for this time.
Thank you. I request everyone to applaud her because she's not a chapter secretary, she's new. Their chapter is very small, very recently started, but still they have done so many activities with and so enthusiasm. They are love working. Thank you so much. Next, I would like to request Puducherry chapter. Can please adhere to the timings, 5 minutes.
Welcome to all, especially very thanks to Dr. Samandam and other executive SOMI members. My virtually chapter secretary is not here, but I am present here. First of all, I introduced myself, A. Madhuri, NRH Mena, coming from Pondicherry. I am working 18 years of NRH in Pondicherry state. This year, 8 years completions of NRH. Annual report of Church chapter for the year 2024. Dr. Santosh Kumari, Chief Secretary, is not here. Till I am present here. Next one. Next slide. Puducherry, SOMI Puducherry chapters started our SOMI Puducherry chapter in 2008 with within 24 members only. In 2022, we had more than 550 members. At present, in 2024, till date, 729 members, 729. This is wrong. 684 is not till date. 729 members only. 743. 749. 749. The society started with the objective of providing extension, maternal and child health care, and creating awareness regarding safe motherhood and the problem of pregnancy. Train active nurse, midwife, nurses and other health personnel and safe delivery and respiration of infant. Next one. Puducherry chapter executive meeting for new office barrier in our Puducherry. New members were elected during executive meetings on April 4, 2024. The chapter started to function in College of Nursing, Indira Gandhi Medical College and Research Institute of Puducherry. SOMI Puducherry chapters executive meeting for new office barrier in our Puducherry, Dr. E. Primila, Honorary President, Mrs. K. Kalayarasi, President, Mrs. P. Lakshmi Chaitanya, Vice President, Dr. M. Santosh Kumari, Secretary, Dr. J. Jayabadi, Joint Secretary, and finally Mrs. R. Nithya, Treasurers in our Puducherry SOMI. SOMI chapters activities. 60 new members were encouraged and registered in SOMI in the year 2024. All members got their memberships card. Women's Day celebrations was organized by Rotary Club of Puducherry. Ma'am, previous slides showed to me, ma'am. Previous slides. All members got it. Next, ma'am, next. Okay. Previous. Back. Oh, enough. All members got that membership spot. Next one. Next.
It's not working. In between, it doesn't.
Women's Day celebrations Women's Day celebrations was organized by Rotary Club of Puducherry College of Nursing, Indira Medical College and SOMI Puducherry chapter in the month of March 2024. Next month, next activities SOMI Puducherry, International Day of Midwife celebration in College of Nursing, Indira Medical Science and MTP Puducherry on May 624. Next activities International back now. Next, back. Okay, ma'am. SOMI Puducherry chapter activities anemia testing camp for adolescent was conducted in Indira Medical College and the Research Institute Puducherry. Next one. SOMI Puducherry chapter activities new criminal law awareness given to adolescents from College of Nursing, Indira Medical College and Research Institute Puducherry and School of Nursing MTP Puducherry on 13th May 2024. Next chapters celebration of World Immunization Day by blood donations of adolescent volunteers from College of Nursing, IGMC Puducherry. Puducherry chapters activities conditions of poster competition in creating awareness towards World Tuberculosis Day by SOMI Puducherry chapters and the Community Medicine Department of IGMC Puducherry. Next, posters, essay and elocution competitions were conducted on before celebrations of World Breastfeeding Week 2024 in the month of August 24. Health education was given to mothers in OG ward and postnatal ward and importance of breastfeeding. Health education was given to mothers in OG ward and postnatal ward and importance of breastfeeding on behalf of the celebrations of World Breastfeeding Week 2024 in the month of August 2024. SOMI Puducherry chapter activities attend OG conference on recent advances and innovations in obstetrics and gynecology organized by Department of OPG and IGMC Puducherry. Chapter Secretary Dr. M. Sandesh Kumari presented paper and got it first prize. Members of the Puducherry chapter icon, I showed that 2024. Previous. This one.
That's very good.
First prize. Next one. Awareness of essentials newborn care was given to adolescents in various colleges in record to newborn week celebrations. This program was organized by Department of Pediatrics and SOMI Puducherry chapter from College of Nursing, IGMC and Puducherry on November 16, 2024. Essential Newborn Week is celebrated by Department of Pediatrics and SOMI Puducherry chapter from College of Nursing, IGMC, Puducherry and November. Next month. Voluntary HIV testing awareness was created among the public in account of celebration of AIDS Day 2024. Nutrition Week celebration held on 9/10/24 to create awareness and balanced diet and diet to be taken during pregnancy and lactations. The event was graced by our officer on special duty, Department of Health and Family Welfare Service, Government of Puducherry. World Mental Health Day was celebrations on 10/10/24 in creating awareness about the importance of mental health among adolescents. Awareness and menstrual hygiene was given to adolescent girls of various colleges of Puducherry and 10/12/24. World Hypertension Day was celebrated on 17th May 25 by SOMI Puducherry chapters at Department of Medicines, IGMC, Puducherry. Poster competitions and diet display was done by nursing students of various colleges of Puducherry. The Society of Midwife India Puducherry chapter organized a state level workshop on women health through Yoho in the occasions of International Women's Day celebration 25, the theme of action. Government of Puducherry has sponsored 6 ANMs and and elegy for this 17th National Conference of SOMI hosted by Assam. SOMI Puducherry Chapter Activities Action Plan for 2025 SOMI Puducherry Chapters. SOMI memberships more than 100. Symbolism on essential newborn care in College of Nursing IGMC Puducherry. Adolescent health awareness programs. Planning national conference in midwifery in the year 2025. Puducherry Chapter. This is for first time presentations in this Assam state. Thank you so much, ma'am. Conclusion, ma'am. Conclusions. SOMI Puducherry chapter is poised to run towards its goal with more uniform stamina and commitment at a gesture. I take this opportunity to thank all the good words who were behind the success of SOMI Puducherry chapters.
Student. Outgoing student. I am so we have a rule saying only if you are registered as a midwife you can go register. But if you are not yet registered but passed out, and if the principal thinks they are all passed, this is only in 1 or 2 cases. We have not given this permission. Because it can be unethical. Teachers can easily pressurize students to become members. No such behavior. So to avoid that, we said don't register them when they are students. Don't direct money from them when they are students. But if they have passed out, they have already applied for registration. Once or twice we have said okay, they have already applied. Otherwise, no. Most cases, yes. Most cases, yes. They are already. Yes, because they are already student, first year BSc, says, I want to be SOMI member. Wait, I want to be SOMI member. We are welcoming her as associate actor. She can convert to
Thank you. Next, I would like to request Telangana Chapter Secretary.
Good evening, everyone. This is the history. I think I am from the headquarters, so I don't want to go to the history of it. But I am newly appointed as a secretary. I recently been appointed on February, so I took up a charge. And then the next slides. Mrs. Esther Sunila was our first chapter secretary, followed by I have Shanti ma'am among us as a joint secretary, and she's been here amongst us. So next. So the objectives of this thing. I will only focus on the area and all. We are aware, so I'm not going to do the statistical data. But yes, we have our policies and objectives right from SOMI, and the current achievement what we have here is our SMTIs and NMTIs, where we have been got it in Telangana, where we are focusing on normal physiological birth, and also we are avoiding the interventions, and we are decreasing the C-section rate. That is our target. And then next. So far we have been achieving it, and we have almost trained. Next slides. So these are our key challenges along with the government, and we are also facing a lot of problems during our practice, especially NPMs and the educators, along with the government of Telangana. But yes, there is a marginal decline with our MMR rates and compared to the other states, and also we are declining of our C-section rate as well, because we are focusing on normal births, physiological births. Next slide. I think you are aware of the new initiative that is Government of Telangana has taken up. As I told you, there are 345 NPMs whom we have trained them as an educator, and part of it, these NPMs are being posted at different PHCs and all the sub-centers around Telangana state. And the government has put in target of more NPMs who have to come up. Around 1,800 they wanted to train with both two SMTIs and NMTI. And recently the achievement is that we have done the registration. The process has been happening in their council, but there is some glitch in our system. So we are yet to register these NPMs in our council, ma'am. Coming to the glimpse of SOMI that we have done as all of us. Here we have done symposium at the newly established one of the colleges which have recently come up in 2019, and from there 8 colleges have come up. This Mancherial is one among them. And we also organized the symposium at Nilofer. This is mother and child. Next slide. This is as College of Nursing as International Midwives Day has been observed, and all the representative from the SOMI office has been our guest as well. Next slide. This is same mother who been observed at one of the PHCs at our Cherlapalli place, and this is breastfeeding week as well. Next. We have a guest from American College of Midwives who have also visited our nursing college and as well as the headquarters. We were being part of it, and we have the SOMI has been told what are the activities that is being done in our headquarters, and since ours is the headquarters part, and we also run many programs under SOMI office. And they were very happy to visit our NMTI and the SMTIs, and we also learned many things what's happening around the other international midwife colleges. Next. This was the NMTI Innovation Institute at Government College, Secunderabad, and SOMI was also part of it. This is the first batch of NPMs, that is the pilot batch, and they were also part of it, where the certificate was given by the Health Minister. And then we are yet to get the admissions from for the NMTI right now. As per the Gazette, we have got the NPMs. We have put forward to the university that this NPM program has to take up by the university, which has been done, and we are happy that we have got the admission for this academic year. 24-25. So we have 26. We are just about to start the NPM programs under the university. We are very disappointed because NPM program is not taken up by the government, by the university. So they were asking for the Gazette that whether the university can take up that. So, ma'am. Yes, ma'am. So they are objecting it because 6 months of training and 12 months of mentoring modeling, which is not taken up for the university. That is the only thing. Thank you, everyone.
MPM is a post-basic diploma course. So whether university they will give a post-graduate diploma or post-basic diploma. I don't think post-basic diploma by university is not, I think, they are not empowered. So, yeah.
Additional qualification.
Yes.
We are fighting for something, we have to fight for the higher.
Yeah. So 6 month addition course is fine. And one more thing, ma'am. See, we don't require registration for NPM because they are already RNRM. Only additional qualification is to be added to their original registration. No need for any fresh registration for NPM. It's not required. INC has also said that. INC has also circulated. If any additional course, no new registration. This will be additional qualification under the original same registration. additional qualification, not new registration, ma'am. It's not required.
Duration is increased, no, that is 6 months. When
Any more?
Yeah, if it becomes ma'am postgraduate course, then only BSc nurses will be eligible for admission. In that case, diploma nurses are not eligible to enter in the NPM course. This is the main. Yes.
issue for GPM, because it affects everybody.
Okay.
It's a very, very important issue.
Yeah, these are the regulatory issues, ma'am, and it can be solved with regulatory bodies only. Yeah.
Can we keep this discussion for AB? GPM, please. Request West Bengal.
Good afternoon, everybody, executive members and all SOMI members. I am Shubha Rai, Chapter Secretary of West Bengal SOMI Chapter. All of you know the West Bengal SOMI Chapter is the oldest one. It is now 21 years. It is a very young, biggest. Thank you, ma'am. And SOMI Chapter was established in the year 2004. And then the chapter secretary was Madam Vandana Das, and the president was Kalyani Bhattacharya, and the treasurer was Madam Kalyani Pala, and second chapter secretary was Madam Mitali Odhikari, and third chapter secretary was Madam Manushi Dana. They are present here now as an executive member. It's my privilege and blessings also. And I am from the 2021. My president is Srimati Bharati Chatterjee, and me also chapter secretary, and treasurer Srimati Lakhi Ghosh. The West Bengal chapter also done so many works, and they already organized many state and national conferences. Recently we organized our 5th national conference at Murshidabad College of 5th state conference and 3rd regional conference in the year already given, but and we our activities as a SOMI chapter, we celebrate the all most important days, that is the International Midwifery Days, Safe Motherhood Days, and Breastfeeding Week celebration. All celebration we done by the in our various College of Nursing and private or government both, and communities also under the banner of SOMI West Bengal chapter. And we successfully organized all these programs also. And most important part is that we already published our newsletter. It is very important milestone for our chapter. It was both English and Bengali version. The name of the newsletter is Bhumika. Then we work many works during our pandemic or any natural calamities with the collaboration of UNICEF and WHO and others NGOs. Also we attend Asia specific conferences all the times, and all national conferences we also attend and chair the various important role, and we moderate the various program also. And we also opening the help to open the new chapter that is at North Bengal and at Meghalaya. We work as a partnership with UNICEF for supportive supervision to improvement of the labor room transformation, and the mentoring of the staff nurses for better practice and respectful maternity care.
we also, our future plan is more membership drive, because our now the total member in our state is near about 2,500. Near about 2,500, and it is our next goal to drive our membership by organizing frequently our state conferences and other state conferences and other meetings also. Then and also we work to the our nurses in our state. Our nurses and midwives are facing great challenges to reduce cesarean section rate, to increase natural birth due to inadequate staff strength, lack of enabling environment for mother and midwives, autonomy and decision making ability. So we want to provide their technical support for overcome these challenges also. And frequently organized also already told me, and continuing labor room transformation work and supportive supervision and mentoring with the collaboration of UNICEF, and organizing another more symposium with the collaborations of Himalaya. Then celebration of the 8th March Women's Day, 11th April Save Motherhood Day, 5th May International Midwives Day, and also the breastfeeding week celebration, and the organized state conference each year. These are our action plan. Any question? Already we told this 5th state conference, and a large gathering was 700 participants also.
And participated more than
700. State conference. Thank you. Headquarters always support us, and they always advocacy has given to us. And Madam.
during that time, Assam chapter people also came, no? Nita and Inu came there. Madam also was there. We were there.
In the national conference, it is our great success. Already we are in planning phase for organizing regional conference in Kolani Nodia district. We are now in planning phase also.
Thank you so much. Lots of activity, lots of members from West Bengal, and our great leaders are there in West Bengal. Thank you so much. Next, I would like to request a Chandigarh chapter. 2 minutes, please. So, good afternoon, everybody. So, about Chandigarh chapter, Chandigarh is a small place. Maybe one district of you or one city of you is the total Chandigarh. And we have only 3 institutes here, 3 secondary care institutes and primary care institutes. And members, every time I make 100 members, then the list from SOMI comes, it says you are 55. Because what happens, all the people in Chandigarh, they have residence either in Punjab or in Haryana, and they give their residential address Chandigarh or Haryana. And the list of new members, they say that they are not Chandigarh members. They are either Punjab members or Haryana. I don't know. I should start telling them to write their official address only. Because otherwise also, मोहाली में रहते हैं, चंडीगढ़ में जॉब करते हैं. So please membership drive. So that's why we cannot have more members. Though we every time make members. And these are our executives. Avinash Rana ma'am, President, myself Secretary, Banka Lakshmi Vice President, and
So this is a little view of Chandigarh. है ना? Please. पिछले slide कर दो थोड़ा view. So Chandigarh chapter opened in.
Slowly, slowly, one by one.
So this is just a view of Chandigarh. As I said, it's a small state. Please next. So our chapter was opened in, it's very new, only 1920. During the COVID period, Mithali ma'am has announced the opening of this chapter, and I said 100 members. I completed, and again SOMI says 50 or 55. So we had, as per report, we had a symposium on journey of pre-eclamptious mothers and their newborns. So this was in collaboration with the Himalayan team, and 100 members, as say that 100 members, which included ANM nursing officers and students, faculty, total 100 members attended it. Next, please. So these are the glimpses of this symposium. Next. So breastfeeding week we celebrated, and we had the health education sessions in CLR extension, gynae, OPD, maternity, neonatal nursery, and in community. And these are a few glimpses of it. Then we had attended this SOMI North Regional Conference in big way, organized by Rati ma'am. So these are the glimpses of that conference. And then National Newborn Week celebration. There we had with 3 organizations, that is SOMI, IANN, and NTIA. So we all together celebrated, and with the health education. So these are the glimpses of that. So that's it about this. And thank you so much. मतलब बार मुझे ऐसा होता है, मैंने तो 100 की लिस्ट कंप्लीट करी थी, ये फिर 50 में आ गए। मैम लेते हैं वो लोग मोहाली से आती है, कोई पंचकुला से आती है, तो जब अपना पंचकुला का एड्रेस या मोहाली का एड्रेस देती है ना, तो वो पंजाब हरियाणा में ही ले जाते हैं। जैसे आई लिव इन हरियाणा, आई राइट माई रेजिडेंशियल एड्रेस पंचकुला, लाइक दैट। आई डोंट राइट इट, आई राइट इट चंडीगढ़। एटलीस्ट रायसिटी के मत किया गया।
Next, I request UP chapter report by Surbi. Surbi short में 2 मिनट में।
First of all, I would like to thank the UP chapter on behalf of that I am presenting this report, and I am privileged enough to present the report. Yeah, just 2 slides now. Fortunate also to stand and present the chapter. So I would not like to go in background and history, but definitely UP chapter have started its first of the NMK, I think everyone knows, in the College of Nursing Meerut, and they are the first batch of midwifery educators, have trained 26 midwifery educators from 4 of the different states, that is Uttarakhand, Odisha, and Sikkim, and one was Uttar Pradesh. 9 of the students are from the Uttar Pradesh. And recently on 8th of March, our MD NHM, because of this NMTI is under the NHM, have recently inaugurated the SMTI Kanpur, that is the State Midwifery Training Institute Kanpur. And NHM is now under the process of giving the advertisement and recruitment of the 30 NPMs in SMTI Kanpur. Definitely, we have one other SMTI at the College of Nursing, KGMU Lucknow, but it has yet to be inaugurated and established. So going to the activities, we have much of the state workshops. Then in 2019-20, we have SOMI UP chapter. Means like KMC, we have breastfeeding. We have celebrated in the last year from that, and now on December 15, 21, we decided the session on the birth companion and the midwifery care unit in training in the theme of on RMC, that is CGHS institution at Safdarjung Hospital, New Delhi, and the course that is from April to June 2021 in Ministry of Family Welfare. We have like one of the colleague, that is Renuka ma'am, our President Dr. Geeta Parvande ma'am, and myself have been participated in the midwifery leadership program for the upliftment of the midwifery in the states. Definitely after the implementation of midwifery initiative, we have decline in the, it's like not a static decline, but definitely a small percentage I can say in the MMR and IMR of the state, but definitely it is high from other states still. So need more NPMs and educators to produce so that we can have good, we can have the reduced IMR and MMR in the state. Thank you.
Thank you so much, Survi. I'll be presenting 2 minutes. I'm representing the Karnataka state, as our chapter secretary and presidents are not there, and I would like to tell about a new chapter of Goa because I have been for the inaugural, so I know about it. I'll start with Goa because Goa is a new chapter which has been inaugurated on 20th August, so 20th December 2024. On a single day, we have organized a symposium followed by membership drive. On a single day, we did 100 membership on spot. Everybody did, and they participated in the symposium, and thus the Goa chapter got. Now, as on today, the membership of Goa. One madam was there, Shashi madam, and few members who were studying in Karnataka were become member and they shifted to Goa. Thus, as such, members were there from Goa, few hand count, but yeah. And chapter was inaugurated on 20th December. And as of today, Goa chapter has 144 members. And about the Karnataka, it has been the SOMI chapter has been established in the year 2007, and first the chapter secretary was Dr. Sudha Reddy, who introduced me to the SOMI, and thus I became member, and thus as I'm here today. And as of today, we have December 2024, 431 members are there from Karnataka, and we have one NMTI at Vani Vilas Hospital, Bangalore, and SMTI also is there at Vani Vilas, one at Chellavamba Hospital, Mysore, and one at Belgaum, which is of my hometown. And the thing is like we don't have any much members from government sectors. The people who are members are from private sector, so we cannot actively participate in any kind of decisions making or any activities related to midwifery which happens from the government. We won't get to know about it. Now because of SOMI and as my connections are increased, I am getting to know about some of the initiatives which will be held in the area of midwifery, so I am getting to know. Otherwise it was quite difficult for us as we all are from private sector. So this is a little, we celebrate all the activities throughout Karnataka. We have a SOMI members WhatsApp group as well as Facebook, all are active there. So thus I can spread the activities, what awareness activities and what activities the other every people members what they will be doing. They will be keep on posting. Thus, we get to know about the activities related to safe motherhood, Midwives Day, and Women's Day, etc. So this is a little bit about Karnataka. Thank you so much. Now I request the dignitaries to add their points as we can go on. I request Jasu Madam to give your closing remark, thus we can continue with Jibu.
Thank you all the members. I congratulate all the chapter secretaries for presenting brief and very active and vibrant report. SOMI is expanding, yes, very fast we are growing. I will not take much more time to add few things what we all have reported. SOMI is basically advocacy association. We will continue to advocate, but the points of our advocacy are now towards the independent delivery practice will be there. Second will be regarding the additional qualification registration for those NPMs. And third will be their practice in government sector as well as in the private sector, how they are going to practice, what will be the limitations, delimitations, scope of practice in various settings, rural, urban, corporate sectors, private practice, all those will be the points of advocacy for the SOMI in future. I think these are the few things, and we have already said in the morning, we will be publishing white paper. We can work more on the scope of practice for midwives and present it to the government for implementation. And the cadre creation is especially very important for the government people. They all are working in Gujarat. More than 400 NPMs, they are working in government setup on contractual basis more than 12 years, 13 years. They are working on the fixed, very small salary. They have only one demand, make us on a regular scale appointment for us, and which is not happening because it is a state subject and states are not willing to release the budget for any new cadre in nursing. Simply they say we don't want any new cadre, and now the another evil, I will say it evil only, it's an outsourcing of the services. All these big contractors, they are there, all the contract is given to those people and they will hire the nurses, they will hire the midwives, they will hire all the class 3 employees, group 3 employees, and services are provided through them only. This is the new thing coming very fast. It started in Gujarat few years back, but I think now it is spreading in the whole country, and not only for nurses. This is for all other cadres also. So we are also facing the same issues, and we do not know exactly how to overcome with this issue, which are throughout country we are facing these issues, and not only nurses. All government employees, they are facing this crisis. And whatever they are doing, we will also concern with that. And at least so far, the midwifery is concerned. Yes, we as a SOMI, we would like to promote the independent practice to help the women not to go for any so much of procedure and clinical. And the Clinical Establishment Act, that also will be one point in our advocacy. The Clinical Establishment Act should not include the normal delivery places. Labor rooms, maternity home, they are not clinical. There is nothing clinical in it, it's all physiological. So at present Act, the maternity homes where normal physiological deliveries are conducted are also covered under that Act. And there are so much requirement for clinical establishment, which is not needed for delivery. So these are the points. Wherever the SOMI is invited in any such meeting, we are raising this point that this is not required, but as usual, the SOMI voice, somewhere it is heard, so many places it is not heard. So unless we make our association strong, we raise our voice, nobody is going to respond us. To make the voice strong, we need to stand together and be united and make SOMI strong. So we from the headquarters can speak loudly. This is our expectation from the members. Thank you very much.
In Uttar Pradesh, I would like to say that we Miss Educators have been registered under Uttar Pradesh Nurses Council as NTMA educators, and we don't have separate registration. Additional certificate, what you are talking about, they have given us that only without any different registration number. So we are with that.
Exactly, that is what required. They have done very good decision, and exactly this is the guideline, even circular by Indian Nursing Council also. If you, and even for others also, this is for the general information. If you are going for study to any other state, for study, post basic or postgraduate study in any other state, your basic registration in your state continue. You don't require to be registered with that new state where you are going for study. No need for registration there because you are not going to work there. You have gone there for study purpose only, and after completing your study you are coming back to your state. So it is not required, and your parent council is supposed to register your qualification as an additional qualification under your original registration, under your new register. It is a supplementary qualification. Refer the Indian Nursing Council Act section 10, 11, 12. It said mentioned as a supplementary qualification. If your supplementary qualification is issued by the authority, examining authority, approved by the Indian Nursing Council, check the website of the Indian Nursing Council. There is a list of the approved examining body, all the boards, councils, universities. It is there. If your certificate is issued by the Indian Nursing Council approved examination board, no need for to go to state nursing council where the institution is situated. You can apply to your state nursing council for additional supplementary is the word used in the INC Act. Supplementary qualification under your original number. So no need for additional basic qualification for NPM. Even NPM educator, that is not category. Our category is registered nurse, registered midwife, registered health visitor. These are the registered ANM. These are the 4 basic registration. Yeah, public health nurse is additional qualification, ma'am. Yeah, this may be very old. I am not aware, ma'am.
This I should say because I'm coming from a state which was the first state college in the country, Andhra Pradesh, United Andhra Pradesh, the first state college in the country in 1959. Those people who started that college, they said the graduates of this college will work if they want to as nurses, clinical nurses, RN, as midwives if they want to in the midwifery area, or as PHMs in public health. So, 4-year course and 3 registrations. I have all the 3 registration certificates. I keep them in a file, very safe, because I'm not practicing anything. Now, I tell you, I just want to raise this issue because the number of mistakes we make in our professional growth, the number of mistakes we make. RN and RN, these are valuable, high quality certificates which we have to value, and the value of that certificate is 1 crore, 2 crore rupees, 10 crore rupees. Itna value hai wo certificate. But we are not giving them that value. Okay? Let me just finish up about RPHN. In the year, I think 2010 or 11, you should tell me the exact year, our people like Radha and Juliet and all these people, big people, nursing people, they wrote to the nursing council, we do not require this additional RPH in our state. You draw it. How? I think it is Buddhism. It is bad. It is, I don't want to use the word stupid, but it is losing your rights. When you are having a registration legal certificate to go to any village in India and say I am a PHN, registered, you are telling the council withdraw this registration from our state anymore. You know why they said that? The people of Telangana said this, because by the time Andhra Telangana became different. They said this, Juliet, please agree, Priscilla, where are you? Please agree with me. They said this because the nursing council, Indian Nursing Council said, why only this state is having this special certificate? Why? They are asking that question. Who are you to tell me what certificate I should have in my state? Is my state council not an independent body by the state legislative assembly? They did not fight. My state people did not fight. I came to know about this only 1 year after it is resolved, because I am not in the nursing field now. So many times these little things I don't hear unless someone tells me. I cried that day. Okay? Cried means not with tears, but I was angry, upset. I did walking up and down. I said, what is wrong? You are losing your rights. So now, in Andhra Telangana also, only two, RN, RN. I'm saying RA, I'm so sorry. RHV is there, is also HV, is not the old HV. The new HV is an additional posting. So it is not, there is only ANN, RN and RN. Only 3 registrations we have in the country, which are meant for practice. And we have to value those 3 certificates. And if everybody, people like us, people in this hall, value those registrations, then we know how much, value we have it. And how we can use that certificate. That little piece of paper, it can be used. Sorry, I just wanted to correct that.
Thank you for adding on this.
Thank you very much, ma'am.
Thank you, ma'am.
are also suffering with this state counseling, reciprocal counseling.
So it is only higher qualification, no. So there is no much to it. That will be continued. So 2-3 things I would like to add to Madam what Madam has told. This outsourcing was one thing which has come, for which Government of India has written that it is a professional course, because the nursing associations have fought for it and got it written by the bureaucrats that nursing profession will not be